Okay, hey Mr. Johnson, this is going to be my video for our 48-point assessment kind of deal. So we're going to arrive on scene. We're just going to say that this is a uh, elderly home. Uh, the person called 911 and reported a home invasion. Arriving on scene, the scene was secured by law enforcement personnel. We were stationed on a hold just around the corner until the scene was secured by law enforcement. And then once we got the A-OK from them, we went ahead and moved in. Exiting the ambulance unit, we applied our personal protective gear, walked inside the home, applied our gloves and our glasses if we didn't have any. We found what appeared to, according to the resident, driver's license, which was on the counter collected by Fresno Police Department. It was a 83-year-old male living alone in his home. He had a knife wound to his in his lower right quadrant of his abdomen. He was alert and responsive. We went ahead and I checked for, I did my original OPQRST. He said that the person broke in about half an hour ago, stabbed him, and that he was having some severe pain where the knife wound was, since that occurred about 30 minutes ago. And also he was having some trouble breathing just a little bit with each inhale and exhale. His pulse was okay. It was about 90 beats per minute. His blood pressure was a little low, right around 100 over, like 100 over 65-ish. So that was a little bit alarming. My initial thought was he was losing quite a bit of blood because he was suffering from a knife wound. Anyway, so what we went ahead and did is we stabilized him. He was lying on his floor here. We secured him on a backboard, and then we lifted him up onto the gurney and transported him that way. It seemed to be the easiest way to get him up into the ambulance. We also proceeded to treat him by bandaging around the abdomen itself because we don't want to remove the knife. We're not specifically trained to do that. We went ahead and we applied the blood pressure cuff and would check that routinely every 3 to 4 minutes. And then we also attached the oxygen mask. Once inside the ambulance, we loaded him up. We're en route to the hospital. We did OPQRST again, roughly 7 minutes after he was put into the ambulance. We also went about doing our patient care report and found out that he had no known allergies. Obviously, the cause of the wound was the knife. The knife was not removed from his abdomen area. The pulse remained roughly about the same. Blood pressure continued to hover around the 100 range. Temperature was normal, around 98.4 is what it measured. So he was doing okay. However, due to the factor that he said that the pain rate was about a 9 out of 10, we were cleared to go priority 1 into CRMC for the knife wound. En route to that, we did multiple assessments on him just to get him cleared. As already mentioned, no known allergies, no medication was administered. He told us that he was on Lipitor, which is concerning because that's a blood thinner, and so that would not end well if there was a lot of internal bleeding, which is a big concern of mine. The internal bleeding, damage to any organ, or of such matter. Um, if he punctured a kidney, or he said that he was complaining of some chest or some like problems when he was breathing, so maybe a pneumothorax, puncture to the lung, laceration to the lung. All those could be possibilities that I would not be able to treat in the ambulance without any scans or further knowledge. Anyway, he had no immediate family in the area. His quality of pain was already stated as a 9 out of 10. It was occurring for roughly 30 minutes. It did not really radiate when I asked him, and pushed on the abdomen a little bit if it would move up the chest cavity or to the other side of his abdomen. He said he could feel the knife was there. Obviously, it was stabbed inside of him, but he said that he didn't feel any pain on the adjacent side. So that was good. And then we went ahead and we loaded him up and transported. He had a GCS score of about 12. He knew where he was. He knew what happened. There was no significant psychological issues. There was no head trauma to the patient. We just had the issue with the knife and possible bleeding. We went ahead and we applied oxygen to him at roughly 15 liters per minute, just to help him out for his elderly age and the fact that he was complaining of some breathing problems. He had no prior medical history in the last 6 months, according to him, and so that was just about it. Hope this covered everything.